podcast. Today's number 12. And today's a special day because my grandpa, you know that my grandpa is Sigmund Freud. So I call him my grandpa. I'm a psychoanalyst. I just always wanted to be a psychoanalyst. And today is the 170. I know it's not 170 years, it's 169 years because it was Vienna in May 6th of 2020, 2020, 1856 or something like that. So let me just go, and now that I'm here with you guys, go and right, perfect. So I'm here right there. And that's Sigmund Freud. Today's wonderful. We're not gonna forget that Alisson Pozo Cervantes is gonna present on the role of AI in emotional self-regulations for OCD patients. CURA100 is a global group that we are very much interested in research on the AI, everything that has to do with mental disorders. And we have a team of presenters and researchers that have been with me for the last couple of years. Evelyn Fonseca is there from Chicago. She's wonderful. She's my assistant. And also she's going to be soon a master student of mental health in Buffalo or Niagara? Buffalo. Buffalo?
Buffalo,
yes.
Yeah.
And then Chiara Mariusom, she is in New York City. And I don't know if she's in Turkey or in New York City, but I know that now today is in New York City. And she's a practitioner in mental health counseling. And Alisson Pozo Cervantes is a psychologist from Ecuador. She's a wonderful intern from La Universidad de las Americas, and she's our presenter today. And Evelyn Mateo, she's a psychologist from DR. She's in Yonkers. She finished her master in mental counseling. She's working for her examinations. And of course, Zaim Gemera, she's our intern from Manhattan University, and we're happy that she's with us and that we are here all together. So without further ado, we have our Alisson Pozo Cervantes, our presenters on the role of AI in emotional self-regulations for OCD patients. And she's going to be introduced by Evelyn Fonseca. Evelyn, take it from here.
Okay, thank you, Dr. Pina. So moving on to the introduction. So Alisson Pozo Cervantes is a licensed psychologist in Ecuador, currently pursuing a master's degree in clinical psychology. She brings valuable experience from working in psychiatric clinics in social work settings, which has shaped her deep understanding of patient care. Driven by a passion for clinical practice, Alisson is committed to continual learning and professional growth. She is dedicated to contributing to improve mental health outcomes with dynamic clinical environments and always promoting empathy, respect, and a strong commitment to the well-being of each individual she serves. Without further ado, I'm going to pass it along to Alisson, and yeah.
Thank you, Evelyn. I will share my screen. You see that?
Yes.
Yes.
Okay. Hello, everyone. Thank you for being here. I'm doing research about how artificial intelligence can help people with mental health problems, especially OCD. Today, we will talk about how new technologies like artificial intelligence can help people with OCD to control their emotions. And we will look at what OCD is, what emotional self-regulation means, and how AI can support therapy. What is OCD and how it affects emotions? OCD means Obsessive-Compulsive Disorder. It is a mental health condition where a person has unwanted thought called obsessions and repetitive behaviors called compulsions. For example, a person may feel afraid of germs and wash their hands again and again. This thought and behavior cause a lot of anxiety and stress. OCD is not just about being neat or organized. It is a serious condition that can affect school, work, family, and daily life. People with OCD often know their thoughts and behaviors are not logical, but they still feel forced to act. Many people with OCD have trouble managing their emotions. They feel fear, guilt, or anxiety and don't know how to calm down. So they repeat their rituals to feel safe. But these behaviors don't solve their problems, they make it worse over time. The brain of someone with OCD is often stuck in a loop. Their emotional brain, the amygdala, is overreacted, and their logical brain, the prefrontal cortex, is not strong enough to stop the rituals. Emotional regulations help balance this system. What is emotional self-regulation? Emotional self-regulation means knowing how to understand and manage our feelings. It means we don't act without thinking. Instead, we learn how to stay calm and respond in a healthy way. We all have emotions, and it's normal to feel sad, angry, or scared, but what matters is how we respond to those feelings. For people with OCD, emotional self-regulations help them face difficult emotions without doing rituals. They learn how to accept discomfort and still make good choices. We can practice self-regulation with breathing exercise, mindfulness, and therapy, but we need time to support, and this is where artificial intelligence can help. Studies shows that when people improve their emotional regulations, they have fewer symptoms of OCD. They also feel more confident and more in control of their lives. What is artificial intelligence? Like an introduction. Artificial intelligence, or AI, is a type of technology that can think and learn like a human. It can recognize patterns, make decisions, and give suggestions. It's not a person, it does not feel emotions, but it can analyze emotional signals such as the tone of voice, facial expressions, and words we use. In mental health, AI can help therapists and patients by tracking emotions, offering advice, and helping people practice emotional skills. There are AI systems that can talk with patients, offer exercise, and remind them to stay calm, and the systems are available 24/7, which is helpful between therapy sessions. Application of AI in mental health. Let me give you 3 examples of how AI helps. Emotional recognition. AI apps can listen to your voice and watch your face and feel it for you if you are sad, angry, or stressed. Then the app gives you advice to feel better. Some apps use a smartwatch or measure your heart rate. If your heart is beating fast, it may mean you are anxious. The app can suggest you breathe slowly or take a break. Chatbots and virtual therapists. These are like friendly robots that talk to you, and they ask you feel guide through relations exercise, like a real therapist will. For example, Webot and Wisa are apps that use AI to chat with people. They help people to understand their emotions and suggest activities like journaling or deep breathing. 3. Relapse predictions. AI can learn your habits. If it sees you are sleeping less or acting different, it can tell you, or it can tell your therapist that if you need help. This is very important for people with OCD because early signs of stress can lead to relapse, and AI can detect those signs and give support before the problem gets worse. Scientific evidence and real examples. Scientifics are studying how AI works with therapy. One study from 2023 used an app with CBT and AI, people with OCD who use the app had fewer compulsions and feel more in control. Another study combined mindfulness with digital tools. Patients who used these tools had fewer relapse, and they were also more motivated to continue the therapy. Other example is Pedro is 25 years old and has OCD. He used an app that asks him to describe his feeling during the day. When he feels anxious, the app reminds him to breathe slowly. He learned to manage his emotions without doing rituals. This may seem simple, but small steps like this help people build emotional strength over. AI also helps therapists. It can show them patterns in patients' emotions. This helps the therapist understand the patients better and they plan better sessions. Benefits and risks of AI for emotional regulation. AI gives supports all the time, even when the therapist is not there. It learns about the person and gives the best advice for them. It helps people feel stronger and more in control. It also helps therapists understand how their patients feel between sessions. Some people are shy or afraid to speak about their emotions. AI tools make it easier to talk without judgment. The risk, AI works with personal data, so it's important to protect people's privacy. Therapists and developers must make sure that data is safe and not shared with others. Also, AI should not replace real therapists. It should work together with them. And finally, some people may depend too much on the app. That's why professional help is still necessary. And we need to teach people to use AI as a tool, not as replacement for human support. The future of AI in OCD treatment. In the future, AI will work with real therapists to track emotions and offer help in real time. We will use watches and sensors that can tell when person is stressed by checking their heartbeat or breathing. AI will learn more and give better advice using person's own story and feelings. There will be more tools, I said it in Spanish, and more programs for low-income communities. This will help stop problems before they get worse and give more people access to mental health support. Conclusions, and is my final message. Artificial intelligence is a new tool that is changing mental health care. For people with OCD, it gives hope for better emotional control and fewer relapse, but we must use it with care, ethics, and support from trained professionals. Thank you. This is the reference.
Excellent. All right. So very well. Let me just come here. Let me take it over here. And perfect. So now, do we know, that's my questions to you. Do we know in terms of the severity of the OCD? Have you studied, have you find anything related to for whom will you prescribe self-regulations using AI? How severe, and also medications, psychotherapy, and severity of the OCD cases using AI? What have you found in terms of the severity of the cases using AI? This is to simple one, complex cases, simple cases. Anything that you can tell us about it?
You said about if use therapy, pharmacology, and the apps.
Yeah, how severe have to be the patients to use AI?
Yeah, it's not that severe. I think if it's severe, they need obviously medication and a person who is there. Because with it's severe, it's difficult to the person to regulate himself, and he needs help. Yeah, it's the person who has not OCD severe. It's low level. It's to prevent.
Okay. Why you took this topic? Why this topic is so important for you?
Yeah, because one family, but it's my brother. He has OCD.
Oh,
And
okay.
for family is difficult.
Okay. All right. So let's open the floor for questions and comments on the topic. Let's start. Whoever want to start can start the discussions today.
I'll go ahead. I really enjoyed your presentation, and I didn't realize that AI was being used in the treatment of OCD. I guess this is just where, technology now is headed for all of these disorders. And I'm wondering, with your experience, what would you say is the biggest advantage of using AI in the treatment of OCD?
I think it's because when the person has OCD, the compulsions are very strong, and the AI can help with self-regulations and can help her handle better. Yeah.
Perfect. Thank you.
Well, since Cara asked about that, I'm going to ask the opposite. I want to know about the limitations.
Yeah, the limitations I think is that I said with Dr. Pina is can person had severe OCD can use this app. They necessary use therapies can the therapist can be there to help him, and obviously can take the medicine, the pills, but it's important with OCD. It's severe. Yeah. Thank you. Yeah, you have other question? I don't know if I respond your question.
Yeah, you did. You did very well. All right. So Fonseca, any questions for comments to
Yeah, so I don't know if I have specific questions because yeah, I don't know. It's just this is just a topic that I feel like every presentation we kind of go more in depth with more like little different areas of how AI is going into mental health. And this kind of just reminded me, I was thinking of the scenario in high school. I had a friend who was having panic attacks like really bad, like every night she would like wake up in the middle of the night with like a panic attack and things. And I remember she told me that she um, she couldn't get an appointment with her psychiatrist until like a month or two out. And so like I remember like this was like, this was years ago, but I just remember being like, wow, that's, she has to wait a month, 2 months to get any sort of treatment when she's waking up in the middle of the night, not breathing and stuff like that. Um, and I guess I was just wondering, like, is this kind of something that you think, like, is that kind of a scenario? I mean, obviously it's a different, it's more focusing on panic attacks and stuff, but is it was making me, I guess, think kind of how you were saying, like, with the compulsions and stuff. Um, is this kind of something that you recommend, like, I guess maybe for people who, need treatment, I guess, like right there, or like, need some help right there where maybe they can't go and like they're having trouble and they can't, talk to someone all the time. So like, is that kind of what this recommendation is, or is it more like appointments and like, like that help instead of a professional? I don't know if this question makes any sense.
Can you repeat that? Sorry.
Yeah, kind of like, is this something that is like, like extra help because something with OCD is kind of is something that you experience like you're like, like throughout the day, like something that maybe like comes up a lot, like the compulsions and stuff like that. So is this something that um I guess you would recommend as like a extra like help? Like, like throughout maybe anytime something comes up where they need to talk to someone but they can't. Yeah, sorry, I know that was kind of all over the
No,
place.
it's
I was
okay.
just trying to
Now
describe
I
my thought
understand.
process.
Yeah, it's like, I think like it's like extra help. I don't, yeah, that works perfectly to regulate you when you have problems with the OCD. But yeah, I think it's extra help, but a good extra help, because if you had OCD, you have problems all your day. So this app, no app, this AI help you to that moment. But when you have a big crisis, you need a therapist or you need to take your pills. Yeah. I you respond you?
Yes, for sure.
Okay.
Thank you.
Mm-hmm.
Evelyn, Mateo, do you have anything to say?
Yeah, it's very important topic because it's something that we are dealing after pandemic with COVID-19. Many facing about the after COVID with the virus, many people also feel compulsive with with the topic. It's very, very, very important. It's very updating information, very useful. In very short time, I love it, the presentation.
Thank you.
Okay, so you say one of the risks of using OCD to self-regulate themselves, the patients, it's addiction. And could the application become an object of compulsion too? And how bad, and what would you say in terms of what's going to be the risk really there?
Can you repeat the question? Sorry.
Yeah, the OCD. It's the disorders of repetitions,
Yeah.
impulsivity, and it might take the patients to addiction for the applications. What can you say about that?
With the patients with applications, if you can
The patient with the apps, it might take them to be addicted. It might be a problem for them.
I think, yeah, that can happen, but I think it's not like addiction, because I don't know if I say that helps to breathe, or there's so many options to regulate our emotions. So in their AI, I don't think they have a risk. I think it's more helpful. I don't know if I understand good your questions, but I don't think that.
Okay.
It can happen, but I don't think that.
Yeah, so it means like what I'm saying is most likely, the clinicians, the psychotherapists, the applications, and the way to control it have to be like the psychotherapy has to be very persistent. If you prescribe that application, you have to pay very much attention in terms of how much damage or hurt or good is the applications doing to the patient, because we just entered into this new era of possibility to use new technology like that, but we don't know exactly the real risk of what's going to happen and if will damage the patient moving forward.
Mhm.
And so it means like, do we have to be cautious about it? What would you say in terms of that possibility? Cautious, like be careful about it, about the use.
Yeah, I think yes, because it is not a real person. They can have issues, or they can have problems in the app or something. It's not 100%. It's not 100% perfect, but I'm sorry, I don't know how to say in English this. But yeah, it can help, but we can't trust 100% in that, in AI. Like I said, we need to use with a therapist. It's not just only AI. I don't think it's no puedo decir en español. Can I say in
Yeah, you
Spanish?
can do it. You do it in Spanish, and then you try to translate it.
Ok. Yo no creo que la inteligencia artificial sea al 100% perfecta, porque siempre tiene que haber un terapeuta al lado, y como dije, las personas con OCD pueden tener, muchas personas con OCD son graves, entonces lo tienen que manejar con píldoras. Entonces, lo que quiero llegar es que siempre tiene que haber un acompañamiento terapéutico al lado. No puede ser solo una persona usando solo inteligencia artificial.
Okay, so now you can say it. You can translate it. You can say it in English.
Yeah,
What you
me,
say?
you.
You do it. You do it.
Okay, that I said is the persons with OCD can, I say that persons with OCD can't can use AI, just AI. They need to use with therapists. They can use alone. I'm sorry, I don't say that.
They cannot. You don't trust, or you don't recommend the patients to use the applications alone. Like, he have to be follow up with his own therapist.
Yeah, I don't say every day. It's just like es como un seguimiento del terapeuta cada cierto tiempo.
Like in
A follow-up.
combination? Oh,
A
follow-up.
combination, a follow-up, like a follow-up with the patients and the therapist. Okay, but I have a doctor, so I can use it whatever I want. You're not gonna control me. It's my applications. Maybe I'm paying. So how are you gonna control that? And by the way, I'm very compulsive, so I cannot stop myself from doing things. So doing behavior. What are you gonna do about that?
I think it's like a recommendation. The patients can do anything he wants, but yeah.
But you would recommend them to be careful.
Yeah, be careful.
Okay.
With AI.
So will you recommend us to use it?
What?
The apps for compulsive behavior for the patients? Will you freely say yes, it's good? Go,
Yeah.
clinicians use it.
Yeah, can use because I talk about regulations, emotional regulation. Whatever can use that, but there's others. I'm sorry. There's others can. There's others. I'm sorry. I don't know how to say. Can I say it in Spanish?
Of course, you can say it in Spanish.
Okay. Las personas los pueden usar, o sea, normalmente la regulación emocional, usar la AI como regulación emocional. Hay muchas opciones buenas para las personas que obviamente no tienen algún trastorno, pero yo creo que de responder a su pregunta, sí las pueden usar. Solo que las personas con OCD o otros problemas mentales, pues sí tienen que tener como un seguimiento de qué está haciendo la aplicación para ayudarlos.
Okay. All right. All right. So they need to know the risks, they need to know the limits, they need to talk to their therapist, and I have to have a follow-up. So okay, we know that. So now, but also, it's the applications is right there, so I can use this anytime I want. You cannot control me. How will I know, or what can I do to make sure my patients will follow my instruction? If there is something that you can do about it, technically speaking.
We can do, I said it's like a recommendation, but it's not that, it's other word. It's like, I don't know. I think it's like a explanation.
Explanation, trust.
Is a good explain about how AI can help with them, and if they are risk, how can I do, how to use. I think like a introduction about that, a good introduction about that, because we can control them. You say that we can control them, but yes, we can have a seguimiento. How is it?
Follow up.
Yeah.
So my question will be then, when will you prescribe? When in the course of treatment will you prescribe or recommend an app for self-regulations of your patients with OCD? The when is important. At the beginning, in the middle, when a symptom deteriorates or get complex, when you know your patients in the first visit, in half a year, in a month, when will you say you will recommend the use of this for your patient?
I think we can recommend at the beginning. At
the beginning?
Yeah, we can recommend at the beginning, because I said this can help persons with
really bad
OCD. It's a grave OCD, and yes, it's like a prevention too.
Okay.
But person with grave OCD can help, yes, but can't help so much like a therapist, or I'd say the pills.
Okay, so very good. I was like trying to understand of AI applications to my patients. If know the patient, if the patient is new, I would love to know the patients more. That like a strong alliance, therapeutic alliance or transference is evolved and is developed, so that I know that the person will come to me and will tell me what's going on. If it's called difficult, all of a sudden he cannot sleep because he's using the self-regulations every night, and and every moment. I have the tendency to stop the risk and be very careful to recommend anything of that. But you say, and I understand, which it makes sense, that no, let's give the apps, let's put it out there. So let's give it to them, so that for preventions, in case I'm not there, that they can use it. That's what you're saying?
I hear you, but I don't hear you good.
Okay, so the idea, it's like, do you hear me, everybody?
Yeah,
So yes, it was like, cutting out though.
I was cutting. So it's like, I will not recommend to the patients unless I know the patients already and I have developed a therapeutic alliance with the patients. But what you're saying, as a preventive measure, you will recommend it from the beginning.
Yeah.
Yes?
Yes.
You will recommend it from the beginning as a prevention measure. I just wanted to know that because I have not applied it to anybody, have not recommended. I know Dr. Hamid, he has a lot of apps and medical apps where you can know, like biohacking. I biohack my body. I know my sleeping pattern. I know my respiratory, my breath. I know my bone density, my fat density. I'm biohacking myself, my body, as soon as I wake up in the morning. So most likely, that's what's going to happen. People will go up to their applications if they are anxious, if they are traumatized, if they have OCD. I can go to my app, open it up, and see where I am. So that's most likely is going to come you're going to biohack your mind also, and you're going to try to self-regulate yourself, probably most likely try to treat yourself, because if there is no psychotherapy or there is no options right there, I will go to the applications to use it for myself. And I believe that's most likely what's going to happen. So now, Nico Cervantes, Bill Gates is saying that in 2 years or more or less, doctors, psychotherapists, lawyers will disappear, and the reign and the power of AI will be all over the place. Do you believe that?
It can happen.
It can happen. What do you say? I would like to hear from each one of you. Do you see that AI applications will substitute doctors, psychotherapists, lawyers in the future? Want to hear from Oso? I'm going to go to Mateo, to then Gemera, and Fonseca. So, Usum.
Good morning, everyone. I actually, that was a fear that I had a while ago, but as I become more educated actually from these podcasts, I'm realizing that I think that it can't replace us. It can supplement us. It can make our treatments better. In fact, I was just going to mention that Stanford has at their Stanford Center for Digital Health in August of last year, they did research for OCD using AI, and they were saying that this could possibly speed up the accuracy of early detection because, according to them, OCD isn't so straightforward when diagnosing it. I think it mentioned like it takes us, was it like 17 years to, I don't know, it talked about some numbers, but it's saying that it could be faster. So I think that it'll only help us, it won't replace us. We are programming AI and it still doesn't have empathy. We have that human touch, which people need as part of their treatment, not just all the mechanical stuff, but there also has to be a human element when you're interacting with the professional doctors. So no, I don't think so.
Okay. Evelyn Mateo, what do you say? Will AI substitute psychotherapists and doctors?
No.
No? Okay. What about you, Fonseca?
No, I don't think so. I think maybe
Any reason why?
I think some jobs, like I think like the more like nursing assistant jobs and things like that, I do think, especially that video that you sent of that guy walking in and just talking to someone on a screen. But I think that's more of the jobs of people who do intakes and, like lower than actually a doctor. I think it won't replace doctors and like clinicians and things like that. But I do think some of those like nursing assistant jobs, yeah.
Okay, before I go to Gemeda, yeah, but I can go the same way that guy went to this office. He opened up the office. He went, talked to this person. That most likely we know it's a chat, it's a person, it's a AI telling you what to do, but he can input some information, have a diagnosis, have a treatment plan, and then go to his house or go to his pharmacy with the prescriptions, and it's done. I mean, it's been prescribed. I give it to you because, by the way, the doctor is too busy and he cannot see you because so many people. Would you think that could be something that happened, Fonseca?
Maybe, but I don't think it'll ever get to a point where a doctor isn't supervising like prescriptions. You know, like I don't think it'll ever get to a point where AI can, like AI has the supervision to do that. I think even if like there are like, even if that patient is using AI for like the intake stuff, I think that there still will be a doctor supervising the prescriptions and things. Like I can't see it ever getting to a point where AI just, oh, you can prescribe whatever, you know, and you can get your prescription from your AI consultation. I can't see that. But yeah, that's what I say about that.
Okay, it could be like, okay, I get there, I can hear. Then, all right, you're a patient of Dr. Pina. Thank you for being here. We know that this medication is prescribed to you. Dr. Pina is not available right now. I am Dr. BCT 24. Do you want me to prescribe the medication that Dr. Pina is prescribing to you? Yes or no? If you say yes, you're responsible of taking this medication. Also, Dr. Pina will be responsible, but because you are part of our caseload, do you agree? Yes or no? Do you think something like that might happen in the future?
Yes, but with still like I think that could be a huge problem if people are just able, like if AI is able to write off on prescriptions. I think that can turn into a very big problem. I hope that never happens. I would hope that still like AI could say, "Do you want this refilled?" and it still has to go, like a doctor still has to sign off on it. I know even like pharmacies like Walgreens has the voice caller, the AI voice caller or whatever it is. I don't know if it's AI. And you can do all that, but then it still has to go through the pharmacist or the doctor who prescribed the medication and stuff like that. So again, I just can't see AI being able to prescribe medication without a human doctor being like signing off on it. I think that would lead into
so Alisson Nicole is saying like, well, you can, it's a preventive. I can give it to you. You can use it. You can take it to you. And it will be a chance that where we can speak to my doctors right there. That is not person, but it's the avatar of my doctor, and he knows everything. And then I as an adult willing to consent can say yes or no. Gemera, what is your take on the issue?
I hate to be the sore thumb, but I disagree because it's not that I think we're going to be replaced, but I think that with AI, what we're going to be able to do is just going to be so minimal and not as much as we could or should be doing because of that much assistance from AI. Even the president's speech is chat GPT generated. So it's like it's gonna make me want to do more, but I can't because now you're into this. And I also
the president's speech, what do you mean?
like when they're reading off the prompter, that's chat GPT generated.
Okay.
So, and I also disagree with using it in the beginning because in the beginning I really want to form that alliance like with my client. Like I want you to know me, I want us to know each other. I want to get everything down first. And then after that, maybe we can implement like a training for how to use it properly with our clients and they can take that with them and it can be a support along with our help.
Oh, okay. So you disagree? Nicole Pozzo, what do you say? She disagrees. She doesn't want that to be used at the beginning as a preventive measure. Do you agree with Gemera?
Yeah, I agree with Gemera. That's true that she say.
So glad that was your response.
So you will you will say, okay, let me, instead of giving anything AI to my patients, let me wait until there's a strong alliance that I can control well. Yes?
Yeah, yes, that's a good advice that Jimena say.
Okay, perfect. So I think it's we have discussed the topic and the possibility and the risk of using anything's AI for our patients. We have checked a little bit in the future of maybe we might be, we might not. I believe with Evelyn Fonseca that somehow we, the psychotherapy, will be supervising. That it's gonna be override through the AI to do whatever they want. Now, my final question is going to be, yesterday I saw an article on on the social media that it's a woman very happy saying that AI or DeepSeek or one of the AI powerful applications diagnosed my blood cancer years before my doctor knew about it. So it's better. It's a super intelligent. It knows myself better than anybody else. It's checking myself, what I do, what I say, my symptoms. It will be good. We're gonna be a higher preventive measure. It will be good at giving me treatment plan. It will be even better than my doctor. It's gonna be proven that it will know more about me. So it's not gonna be a matter of me going to the doctor or going to AI. It's like, will will it be a moment where I will be more trustable to the AI? Will that be a moment where I will say, oh, no, no doctor anymore? It means like I know as a fact that is better than the human. So I will go for the AI. Usum.
Oh, you stirred the pot. I was going to say, I feel like it's still infallible. It's still programmed by humans, and humans make mistakes. And my example would be if we look at our summaries from Zoom, it still is not even recognizing who's speaking. It's mixing facts. And there's always a statement from Zoom saying, please check for inaccuracies. It's saying because, they don't have everything ironed out. In some ways it's an algorithm, it's a programmable, mathematical equation for all of these things that are put in and spit out. And I think that in some ways it's maybe faster or better, but there are other drawbacks to something that's computerized. And most people still want that human connection, even if you say, yeah, we should use it. Zainab started out by saying that you want to build that connection. That's what I think is going to be where humans are going to, surpass this intelligence, because even if it's programmed, it's still not a real human being. It might have facts, but most of us don't want some robot telling us we have cancer or something dread. We want that human connection.
Yeah, but we lose that human connections if you go to any doctor in America, even your own doctor, any hospital, any clinic, they don't speak to you. They're very rigid and cold. They don't even say hello to you. How are you? What are you doing? How is your kids? They sometimes they forget they're more than the automated, like machine. So wouldn't be
That's
happy
another
when you go
podcast.
to this to this wonderful doctor that's going to be there. Hi, how are you, Dr. Pina? How is your daughter? How is she doing? Oh my God, I'm very happy that you're here. You don't hear that from our doctors. So will be that moment. I'm just thinking about allow where you will want more that things that will know you that more than you know yourself, and that will know you more than your doctor. Will you have the moment to trust that? And I believe with all the predictions that exist, that day is very near, is very close, and we need to be prepared. Of course, the ethical component, the moral component, but if I know for sure you're gonna do me better, you're gonna give me better results, the diagnosis is gonna be prescribed, the treatment is going to be specific to me, I most likely will decide in a specific moment. And I would say, doctor, I come to you because my ChatGPT told me this and this and that. I'm going to pay you $150. I want you just to say yes or no. Oh, let me see. Okay, yes or no. Bye-bye, doctor. I see you. Because, by the way, in Florida, you don't need your doctor to do your lab. You can ask for a company to do your, no, you can get your labs individually, and then you go to your doctor for prescription, for reading and for prescribing. But you can have your own kind body checks. And in New York, in different states, you cannot do that. But anyway, so Alisson, Nicole, any to say before we end? Your final word?
No,
to
it's
us?
okay. It's everything okay. Thank you.
All right. So thank you very much. And thank you. This is our CURA AI podcast number 12 on self-regulations for patients with OCD, presented by Alisson Nicole Pozo Cervantes. We're very happy to bring you these live discussions about research on AI topics and mental disorders. See you next Thursday at 8 a.m. once again. And bye-bye, all of you. Thank you.